welcome back to Nursing Guru. We are back with another session which is related to, sorry. Ah, okay, so second GNM MSN, okay, second GNM MSN, we are teaching medical surgical nursing first, okay, so in that first chapter was finished, okay, so chapter 1 finished. So second unit or chapter, okay, so related to assessment, okay. So if you study this nursing process thoroughly in your nursing foundation, then this is the first step in the nursing process, that is what? Assessment, okay. So thoroughly we are going to see that one. My dear students, you guys are waiting for the revaluation result that also came today. So who are watching this one, you can go and get the update in our Instagram, okay. And moreover, I would like to tell you about the things which is related to the assessment. Assessment is one of the important part in the nursing process and initial part of the nursing process. Why? Because I am telling this one, because without doing an assessment, you can't able to guide or you can't able to take care of the patient properly. You can't able to do your plans and all, okay. So for your planning, for your interventions, the assessment is the basic thing, okay. So understanding what I'm telling, so assessment is very important thing. So in that assessment, according to your curriculum, one second, so we are going to see lot of things in the assessment, why we need to do this one, okay. So all the things are there in the assessment. One second. Where is that? So here we are going to know about the health assessment. So in that health assessment, history collection, physical examination and nutritional assessment, general clinical investigations. Okay, so assessment, okay, so it is one of the very important part of the nursing process, okay. In that mainly focusing on health assessment, okay. So your chapter is all about the health assessment, to assess the health of the patient, okay, health assessment. So under that one you are going to know about the general assessment, okay. So general assessment, the collecting the health history, to collect the health history, what to collect in the health history, everything is matters a lot. So health history, and which assessment you are going to do? Physical examination, okay. So physical examination, next step is physical examination. Next is nutritional assessment, okay. Next one is that you are going to general investigation regarding their family history, social history, economic history, all histories you are going to collect in the health assessment, okay. So before going to that one, I would like to tell you about the health assessment. So it is one of the important part taken place in the nursing process. So for further implication of your care and all, which is very important, health history you have to collect. The next one is physical examination, okay. Physical examination should be there. Nutritional assessment you have to do. General investigation, okay. So these are the major areas you are going to study about in the health assessment, okay. So health assessment is one of the very important part of the nursing process, which is the evaluation of the health around which complete nursing care is focused. Okay, so which is going to be focus on the complete nursing care found in the process. The next one is nurses work in variety of healthcare surroundings to gather diagnostic information for further health status and for knowing the social economic history. So all the things, health assessment is matters a lot, and which taken place in the first place. A health history is detailed patient interview to acquire subjective data before. For example, I am telling you, if you go any diagnostic center also, there is also they is supposed to come and ask you what's your name. Okay, so from there it will start, it will going to collect your further required based investigations. Okay, interviews will be taken place. Through that verbal communication, they are going to gather the data means what? Information. Okay, understood. The next one is that purpose. Okay, so purpose of this health assessment, we can see that the first one is collect the baseline data about the health status of the patient. Okay, so here they are going to collect the baseline data of the health status of the person or the patient to add, ensure and reject obtained data in the history. Okay, so to add anything, to ensure the things, and to as well as to reject or to obtain the things which is related to the history or collection. Okay, so the next one is to confirm and the recognition of the nursing diagnosis, to find out the nursing diagnosis. Okay, so to for this purpose also it is very important to make clinical judgment. Okay, so for making the clinical judgment, for taking any kind of decision, the assessment is the crucial part in the nursing process. Hope you guys have understood the purpose of the nursing assessment. Okay, so to estimate the outcome of the care, to estimate, suppose we are giving something means we are of course expecting the same from their side also, no, not in another things I am telling. So we are expecting the outcome of the patient here in the medical, especially in the nursing field. The outcome is that the means bring back of the patient's previous health. Okay, so how here means we have to provide a promotive care to the patient, curative care to the patient. So we have to rehabilitate the patient from the actual sufferings. Okay, that is what we need to do. Now we can see the principles. The principles, same thing only you can apply in all these areas also. Purpose, principles, history, everything I will tell. Okay, so very first the principle is that the foundation of nursing care is the intervention, and intervention is provided through accurate and timely health evaluation. Okay, so they have to provide the accurate timely health evaluation. Okay, the next one is a thorough examination should be done. Okay, so for making a health assessment, the thorough examination from head to toe, the examination has to be performed thoroughly. Okay, so for a unbiased care. The next one is data collection, documentation and evaluation of the patient's health state should be done in the health assessment. We can evaluate what will be happen to the patient. Okay, so we can able to collect the information what has been happened to him. Okay, so through that only we can take a place of another interventions, right? So there it will be very helpful. The next one is it should be used in all healthcare locations whereas nurse interact with the patient. Wherever the nurses are going to be interact with the patient, so there may be a must and should process which will be taken place is that the nursing assessment. Okay, health assessment. The next one is the information acquired should be shared with other medical professionals. Okay, so whatever the acquired information will be there, that is of course going to be shared with the other medical healthcare professional, for example doctors or your colleagues. By handovering your duty, we are doing these things. Okay, so the next is that confidentiality should be maintained. Okay, only with the healthcare professional we are going to share. We are not going to supposed to share from the hospital, the outside of the society. Okay, we community, we should be always, healthcare professionals have to maintain the confidentiality, especially in this field. Okay, you should not going and telling blah 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 in front of everybody. You should not do such kind of things. So we have to respect the privacy of the peoples. Okay, so that is also we have to maintain the confidentiality. Okay, so these are the principles. If you follow, means definitely you are going to be succeed by doing this health assessment. Okay, so what is health history? So the next topic is that health history. So history means it is always going to be tells about the past life. Okay, so that is which is related to our health, we are going to be know about. That is what health history in a general way you can say. Health history is a set of questions. Okay, it is a set of questions used to get a general idea about the patient's current health situation. Means those are the set of bundles of questions which are going to be asked to the patient to know about his current means particular now. Okay, so today's situations means exactly the current situation they have to examine, means they have to ask a set of questions to the patient. Okay, so the next one, a full history of the patient present in the health concern. Past health history, for example, we are going to ask about the family history, socio-economic history. Okay, so all these things we are going to be asked. To comprehensive health profile focusing on the lifestyle, health and sickness. Okay, so the next one is that guidelines for health history interview. Guidelines for health history interview. The next one, first one is preparation of the patient. Okay, so the guidelines for the health history interview, the first one is preparation of the, so guidelines under health history collection. So preparation of the patient. Okay, so PT means patient. Okay, don't be confused with that. So the nurse should introduce herself. We have to go and introduce ourselves. This is so and so and so on. So I am the nurse for this particular shift and I am going to give a care for you. So I want to ask set of questions to you and explain the purpose of interview, why we are doing, to know about your health status. I am doing this one, such things you can able to tell them in a polite way. Okay, so that is the first thing. Then she should talk softly, calmly and patiently. Okay, so these are the general things you can go. Then preparation of the environment, preparation of the environment, preparation of the environment. Okay, so environment. So why it is important means you have to provide a proper environment to ask set of questions to get the data from the patient. Okay, you have to provide a good environment. Okay, so prepare. The next one, she should eliminate every type of interruption. For example, TV, this lot of noises. We can't able to gather the data from the patient. Okay, so they will also feel irritated to tell to answer our questions. So for that reason, so in a very calm way, calm place we can conduct. Okay, in the hospital only, in the OPD or wherever you are going to conduct. So you have to maintain calm and quiet environment. Okay, that should be ensured to be maintained by the nurse. Okay, so the next one is preparation of the interviewer. Okay, so who is the interviewer here? So she should avoid asking repetitive question and follow a structured and easy format to the patient. She should inform the patient about recording and obtaining the information. She should end the interview by giving a summary and allowing the patient to clarify his or her queries. Okay, so what I'm telling is that you have to maintain a proper principles to be followed here as a nurse. Okay, so you should not be going to ask repetitive questions, same question again and again. They will feel so bad. Okay, so and you have to be clearly with you what is the purpose of doing this one and why you are recording. Okay, so you have to inform them. Okay, whatever the things you are doing, not only this one in the hospital, anything you have to do means you have to do, write it, document it, and you have to inform to the patient. Okay, so the next one is components of the health history. Okay, so this much is finished. Next we can move with the components of health history. Components of health history. Okay, one second. Hello. One second. The components of the health history, in first thing it will come that biographical data. In the biographical data we used to address that patient's name, age, okay, so gender of the patient, marital status, education, occupation, this one only will comes in the biographical data. And some interview ask more personal questions in the interview, while other weight gain, weight loss, okay, regarding that one we can ask. Okay, so and so the next is that we have to build the trust and confidence with the patient until his or her immediate urgent needs have been handled. Okay, you have to maintain a trust over there. And a patient in a severe pain or suffering from another urgent problem unlikely, so you should not going to be stress them, okay, in the pain and all. How much you can able to grab the information, that much you can get or else you can get from the family also. Okay, biographical data components only. First one is that biographical data. Okay, biographical data, which is very important. So here you are going to collect the general history of the patient, which is related to his name, locality, education, occupation, marital status, children, family, okay, so income, everything, age. Okay, that is what about the biographical data. The next one is chief complaints. What has been happened to him? What is the suffering things by the patient, that you are going to collect in the chief complaints. Okay, so the chief complaints. So chief complaints you are going to collect, no? So that is what the problem that provoked the patient to seek the help or the care of a medical professional, okay, which is the need, which which portion or which component is make him to go to hospital, that is you have to going to ask in the chief complaint. Okay, so which is related to his health. Okay, so the next one is, it is generally elected has been done related to lot of information which is related to his past health history you are going to collect. Okay, the next one is family history. Okay, so the next one is family history. In case of genetic inheritance or any kind of consanguineous marriage, for example I am telling, this time there may be a chance to get any kind of abnormal kids. Okay, so due to avoid those kind of things, there is a need to ask. Okay, even in case of communicable diseases also there may be chance to ask, especially if this tuberculosis and all will be there, means definitely the doctor will be going to be asked that one. The next one is patient profile. Okay, so the next one is patient profile, family history. After that, review of system. Okay, review of systems. So review of the systems. ROS. Okay, review of system means system evaluation covers general health overview, as well as the symptoms specific to each body system. Okay, so it is important to record both negative and positive responses. The information thoroughly analyzed if a patient gives a good response to queries concerning to the particular system. Formal checklist can be used to arrange the system review, which becomes a pan of the health history. Checklist advantages being safely, easily examinable and less prone to errors. Okay, so review of system means generally for getting the information regarding the previous and present symptoms, the questions are going to be asked regarding to the systematically in the system wise. Okay, so that is what the review of systems. The next one is patient profile. More biographical information is obtained in this particular section. Okay, so biographical means age, so related to his personal things. Okay, which means general personal things also they are going to be asked. Okay, already I have explained. Then past life events related to health, if any kind of events which is affecting the health status of the patient, that is also going to be asked. Okay, then current medication, any medication he has taking, that you are going to be asked in the regarding the current medication, to modify, to make them to stop if they are, that is not good for his health. So that is why. The next one is education and occupation you are going to ask, financial resources, environment, physical environment, spiritual environment you are going to be supposed to focus, and interpersonal environment. Okay, so and the lifestyle pattern, these are the things you are going to be asked. And regarding the disability, sexuality you are going to be asked in the history collection. These are the major components which we can able to sir 1 second ನಾನು ಕ್ಲಾಸಲ್ಲಿ ಇದ್ದೀನಿ ಸರ್ ನಾನು 1 second ಕ್ಲಾಸಲ್ಲಿ ಇದ್ದೀನಿ ಮಾಡ್ತೀನಿ. Okay, so these are the so these are the major things we are going to be followed. Okay, so all these about we are going to know regarding the health history. Okay, so there is a certain format is there. First to start with the biographical information. Okay, format of the health history. So their format, biographic data, right, age, this and all we are going to be asked. Okay, so the next one is that demographic data, biographic data and demographic data. Demographic which is related to his address, locality, so that is what it will come. The next one is we are going to ask about the diagnosis. Okay, what has been happened to him. The next one, we are going to supposed to ask about the history of the present illness. Okay, so present history. Okay, that we are going to. Next, past history. Okay, first students understand. First name, age. Okay, general biographical data you are going to collect. Next, address. Okay, address also you are going to take. After that, regarding admission of the hospital, date of admission, related all these things which will be going to collect. Okay, after diagnosis, present illness, past illness. Okay, present health history, past health history. Next you are going to move towards the treatment which is related to past. Also we are collecting the past illness history, means what happened to you, what type of treatment you have you taken, surgical, medical or any other kind of things, and details of the previous hospitalization, how much you are going to, how long you are in the hospital, what kind of allergies you are having. So these are the very important. If they are having an allergy to the penicillin, you are not supposed to administer the penicillin, right? Injections. So these are very important to collect the history, so to avoid the errors in the care. Okay, the next one is menstruation. If it is a woman patient, means you have to ask about the menstruation. Okay, so whether they are getting the regular periods and all, you have to ask. Okay, so age at the menarche and regular, irregular, last LMP means last menstrual period. Then regarding the menopause also you have to ask. Okay, if it is a woman client. Okay, the next one is details of immunization, any kind of vaccination they have taken or not. Okay, so suppose nowadays HPV vaccination is given by government free for humans. Okay, so that is also you have to ask. Okay, the next one is personal habits, their personal habits, having any kind of abuses and all, substance abuse or tobacco chewing, this kind of habits they are having, means you have to ask. That is also one of the reason to get the disease condition. Okay, so that is the thing. Then current medication being taken. Okay, any kind of medication they are supposed to be taking right now. Okay, that sleeping pattern, regular, irregular or any sleep disorders will be there, like insomnia and all. Nowadays everybody is suffering from this one, so due to the overuse of this phone. Okay, so that is why. Then any fitness or exercise pattern, lifestyle pattern they have to ask. After that, a family history, any person is having a chronic illness like diabetic mellitus, hypertension, cardiovascular diseases, okay, so all these things. The next one, communicable diseases will be there in your family, birth or means recent birth or death in your family, that you have to ask. Environmental history, you have a proper drinking water and have a proper drainage facility, environment sanitation, waste disposal, how you are doing. Okay, presence of mosquito around your home, that you have to ask. Okay, then psychosocial history, what kind of language, how you are having a relationship with your peer group or neighbors. Okay, and social support available or not, that you have to ask. Then systemic physical examination, head to toe you have to do. Okay, so tomorrow I will tell about the physical examination. So far we have discussed about lot of things which is related to the health assessment. Okay, so again I will going to be recall this one. Okay, health assessment. So health assessment is the one of the primary part in the nursing process. So there we are going to collect the or gather the information which is related to our health status or the patient health status. Nurse will plays a major role over here, especially she has to ask lot of questions. Okay, nothing but health assessment is that it is all about interviewing the patient to know about his present and past health illness, to make a proper plan, to provide a proper care in the further, to overcome from the disease process. Okay, why he has came to the hospital, that and all she has to know, means so she has to collect. Okay, then one more thing, in the health assessment we are mainly going to study about the health history. In the today class we have discussed only about the health history. Okay, so health history, why we need to collect, means to gain the information from the patient, to provide a proper care for them, to plan it, and you have to exhibit in order to reach the outcome of the health care. Okay, so you have to bring back the health of the patient, right? So for that reason, so certain guidelines will be there. So purpose and principles you have to write, that I know. Certain guidelines, preparation of the patient you have to do, provide a proper environment, and you should not, you have to be always set off with the questions. It should not going to be hurt the patient. Okay, so these are the guidelines you have to follow. So here you can see components, biographical data we are going to collect, chief complaints we are going to collect, and present health history, past health history, family history we are supposed to collect. Okay, so these are the things we are going to supposed to know in the health assessment. Hope you guys are understood very well. This is one of the 5 marks question. Thoroughly you know till the physical examination I have finished. Tomorrow class I will take the physical examination. That is very important. That is why I will give another class. Okay, so thank you so much for watching. If you are not yet taken our classes, means kindly go and tell to your friends also. Anyhow your exams are very near. If you get a class like this, you will definitely going to be clear with the concepts. Okay, so small topics are going to be clear in a broad way, and for sure you are going to learn easy with Nursing Guru. So helpful to your friends also, and tomorrow is the last day to grab the opportunity for 499. Otherwise it is going to be increase the price. Okay, so for more updates, latest updates regarding the courses, you have to follow Instagram page Nursing Guru Official, and as well as subscribe to YouTube channel. If you have any kind of queries, contact our number which is given in the